this week, I worked 14-hour days to treat extra patients, to try and cover as many of the high risk priority patients. We've spent many extra unpaid hours triaging patients. When one is doing that week in, week out, look, last week there were 7.5 million people on waiting lists. That's not because we're on strike.
Just explain why for you going on strike is so important. Why do you feel you've had to do this?
So many of us are going on strike as an absolute last resort, out of desperation, really, to try and make the point, to highlight, to desperately plea for things in the NHS to change. Okay, this strike is ostensibly about asking for pay restoration, but for many of us, this is about working in an NHS that is collapsing, that is not delivering for patients, where we feel handcuffed in not being able to provide safe levels of care now all year round. And it's just not good enough. It's not good enough for this population. I'm an NHS patient, my family are NHS patients, and this is about really sending a message to the government that we won't really put up with this anymore.
This is a 4-day strike, and we're being told that it's set to be the most disruptive strike within the NHS of late. Junior doctors are asking for, I think I'm correct in saying, 35% pay rise. The Health Secretary, Steve Barclay, says that's unrealistic. Talks clearly have broken down at this stage. The question many people may be asking is, well, why don't you get round the negotiating table? Why go on a 4-day strike that could cause more disruption to the NHS that you yourself have said is already in collapse?
What I would say is that in the last few years, the delays, the disruption, the excess deaths that are already happening on a weekly basis that we are being faced with on the front line, the delays to cancer treatments that I'm seeing, patients presented who may have been cured if they had presented earlier, the collapse of services, the collapse of social care, the outsourcing, and the willingness for government to invest in low priority vanity projects and waste enormous amounts of money whilst the system is collapsing and causing harm to patients has become intolerable. And when one is shouting at the top of one's voice repeatedly and being ignored and not being listened to and being forced to take the personal responsibility for a system that is failing patients, it really gets to a point where there isn't much action that one can take other than withdrawing one's labour. And it's a horribly difficult decision to take. I cannot stress that enough. Many of us are deeply conflicted, as we are, though, every day going into work, when we're not able to provide the care that we would like to, that we know we can give. But it's almost as if we are working with tools that are broken. We know what it is that we need to do, but we're unable to provide it with the tools that we've been given, and enough is enough, basically.
Some people may be quite surprised to hear you say your specialism is cancer, you work in oncology, and you just said there that you believe there may have been people, had they been seen earlier, who could have been saved. Clearly, this is a very difficult decision for you. I can hear the emotion in your voice as you talk about this, to actually go on strike. But there are also warnings that the risks are higher this time, a 4-day strike to patients. People are being told not to take risks this week. does that worry you? Do you feel a sense of guilt that you're walking away for 4 days?
Absolutely, of course, of course. But what I would say is, so this week I worked 14-hour days to treat extra patients, to try and cover as many of the high risk priority patients. We've spent many extra unpaid hours triaging patients. When one is doing that week in, week out, look, last week there were 7.5 million people on waiting lists. That's not because we're on strike. That's because of systematic government policy, of poorly invested infrastructure, of collapsing services, of decisions to make to divert money to other things apart from healthcare. My colleagues are leaving in their droves. So the real risk is every single day. And we are seeing that, and we are seeing the human cost and the suffering and the tragedy associated with that. So to say that it is because of us that the current existing waiting list, the current lives being put at risk, and I say lives lost, is because of us, I think is woefully inaccurate and extremely upsetting and quite distressing to hear that, when actually we're taking this action precisely to defend the health service and to try and make it better, to demand better for patients. Look, my mother and members of my family have recently been unwell. My young daughter has been unwell. I cannot trust that an ambulance will come when they have been seriously unwell. Members of my family have been admitted to hospital and have been those statistics of people waiting in hospital corridors. They have been diagnosed with cancer and there have been delays to their diagnosis. Doctors are NHS patients too. Our interests align. And I would ask people, what choice do we have? What would you do if you are repeatedly saying the same things? You are trained to undertake a job which you're no longer able to do, and yet being blamed for the failure of the system around you. What else can one do? And that's what I would say is, it feels very much like we're in a last resort, desperate situation to try and stand up and make things a bit better.
A lot of what you've explained is about the conditions that you're facing and the job that you're trying to do under those conditions. Do you think the demand for a 35% pay increase is a distraction? Is that the real reason? Because it would seem to me that what you're striking for, the reasons that you're going on strike, is more to do with the working conditions as opposed to the actual level of pay.
They are integrally linked. So what I would say is, I would emphasize it's not a pay rise. So I qualified in 2008. I am now being paid 26% less than in 2008, despite 15 years of training, 10 years of specialist training, PhD, masters, etc., etc. I don't think the work that I provide now, 15 years in, is worth 26% less. 35% would just take us back to the beginning, take us back to the baseline. And to put that in context, that would be a 2.5% or 3% rise per year. You know, this is not, we are asking for the amount that we have lost to be reinstated. So if people think it's an enormous rise, it's because it's been an enormous loss to us. And yes, what I would say is that it is symbolic of the wider cuts to the NHS. These two things go hand in hand. When you are within a system that is being woefully underfunded, undervalued, and carved up, essentially, and massively fragmented, your pay is cut alongside that, as it is my nursing colleagues, pharmacists, allied healthcare professionals. Everything is being cut. So the skills that we can provide and the training that we have, the pressure becomes enormous. And the pay issue is about taking that first step of ensuring that the skill stays. That's that first step towards rebuilding the system, making sure that the people and that knowledge and that skill base is there to be able to then start rebuilding a decent healthcare service for people. So it's symbolic, really, I think, of the wider issues of reinstating a good quality healthcare service.
Just a couple of final questions. When you are on shift, what's that pressure like that you feel?
It's something that you are trained to deal with over many years, but having to tell a 37-year-old that they may only have weeks to live, or having to deal with someone who is bleeding, in pain, can't breathe, has blood clots, on top of one of the most horrendous diagnoses anyone could ever hear, that they have cancer. To also see the agony and the heartbreak of families, relatives, imagining it to be yourself and your own families, when you're unable to start treatments quickly, unable to even provide reassurance that services are going to be there to help them. That's devastating. That's genuinely heartbreaking and devastating. And when you're sitting there at 8 o'clock, 9 o'clock at night and having phone calls with people about a lack of care for them, or not being able to provide the care that you'd like to, and then being in pain, discomfort, it really starts to wear you down. It really does, and the pressure is increasing, and it's driving many doctors away.
This 4-day strike is going ahead, and I thank you, Aislinn, for being so brutally honest with us today about how you feel and your reasons for taking this strike action. But 4 days on strike, an NHS that you say you witness as being in collapse, do you feel you have the public's support on this one?
What I would say is, I am the public. I am also the public. I also use the NHS. My family uses the NHS. My mother is a diabetic, and it's probably one of the reasons I became a doctor, was exposure to what the benefits of the NHS, and having a healthcare system that treats everyone without discrimination. I believe very strongly in this system, but it has to be able to provide decent levels of care for people. That is what I'm standing up for. And I think the public know that. They know that we are not in this to make money. They know that we're not part of a private company that is just trying to reap profits. We are desperately running to try and plug gaps and provide the best possible care that we can. And you know what? When you stand on the picket lines, 80-90% of people are very supportive. They've come up to us. They've told us how much they care about the NHS. They know that we're standing up for the service. We had our nursing colleagues out to support us as we supported them. The cars honking as you go by. Yes, I think people know that we are trying to stand up for this service, and the pay restoration is reflective of us trying to demand that conditions are better for ourselves as a starting point for it to get better for everyone in the NHS in general.
And just one question. If you had 5 minutes with the Health Secretary, Steve Barclay, what would you say to him? How does this get resolved? So
I'm not part of the BMA negotiating committee. That's the junior doctor chairs who will be part of the negotiating discussions. So I'm not really privy to what he's saying in private. I only know from the releases, the press releases, that he talks about intransigence on our side. But for us, it's very much that there has been zero move from the government even towards making any offer. And it also feels as if the woeful underinvestment in the NHS over years has brought us to this point as a wider context. So I would tell him to go back to the Chancellor, Jeremy Hunt, who used to be the Health Secretary. I would tell him to go back and speak to the Prime Minister. And I would tell them that they need a serious change in how they fund and organise healthcare in this country, because we are in a devastating crisis. We're one of the richest countries in the world, and we're now unable to provide basic levels of care in key areas across the country. And that is a damning indictment of their policy decisions, and they need to reverse them, and they need to start acting now, and need to start taking it seriously, because people are dying.